You're going to be out there in the field all day, and you might end up with a little bit of manure on your hands. It doesn't matter how careful you are when handling raw manure, it could get dirty and smelly. That's why it's so important to know how to cope with urine infection. What is urine infection? If you are infected with a bacteria, you may experience symptoms such as fever, body aches, and diarrhea. If left untreated, the infection can progress to another level and cause an infection in the blood or other organs. In extreme cases, the infection can lead to a coma or death. What are the symptoms of urine infection? The most common symptoms of urine infection are fever, body aches, and diarrhea. Other symptoms may include vomiting, jaundice, a yellowing of the skin and eyes due to an excess of bilirubin, chest pain, neurological problems such as confusion and paralysis, or quick death from sepsis, a condition caused by inflammation of the blood vessels in the body. How can you cure urine infection? There is no one-size-fits-all answer to this question. However, some tips on how to cure urine infection include: 1. Washing your hands on regular basis and thoroughly with soap and specially water. 2. Should avoid close contact with people who are sick. 3. Getting rest if possible, and 4. Taking antibiotics if diagnosed with urinary tract infections. How to cope with urine infection. The best way to avoid getting infected with urine infection is to avoid contact with the infected person. If you do contact an infected person, wash your hands thoroughly and avoid sharing any surfaces with them. You can also drink plenty of water and eat healthy foods to reduce your risk of becoming ill. How you should deal with the symptoms of infection. Symptoms of infection can vary depending on the type of infection and how it's spreading. If you experience any of the following symptoms, you should call a doctor: body aches, fever, diarrhea, vomiting, or jaundice, a yellowing of the skin and eyes. Tips for cope with urine infection. If you get sick while traveling, take a day off work to recuperate. You can also try to avoid social activities and gatherings that might lead to an infection. Wearing a good outfit when you go out will help reduce the chance of getting sick and feeling exposed to other people. Drink plenty of water and wash your hands often, especially if you are in contact with mucus or saliva from an infected person. Use a hand sanitizer before touching yourself or any other surfaces that may be contaminated. Conclusion: urine infection can be a pesky but manageable health problem. By taking some basic precautions such as getting sick days off work, wearing a good outfit when you go out, and showering regularly, you can minimize your chances of getting infected. If you do get infected, there are various methods available to treat it. Finally, tips for coping with the symptoms of infection are important in order to keep yourself healthy and avoid further problems.